Hi everybody, we're going to get started on antihistamines, which is chapter 70 in your textbook. But again, skim through your textbook and really use my slides and what we talk about and notes that I post. But again, look at the textbook because it usually has some good charts in there and things like that. Okay, so we're going to talk about antihistamines and let's get going on that. All right, so what is histamine? Histamine is released from your body as an allergic response to something. So we have histamine in response to allergic reactions. Excuse me. So how is it distributed? Well, look at this person here, and I'm using an example of someone having environmental allergies, perhaps, because it looks like he has some bloodshot, itchy eyes, runny nose, and just not feeling good. Goes to the pharmacy, and of course you're not going to say you're having, yes, I'm having a histamine reaction. Most people would say, I've got these symptoms going on, what is this? So that's what we have these antihistamines for, which we'll talk about. Okay, so I'm going to move my screen, or actually make my screen a little bit bigger so you can see this. Okay, there we go. All right, so what makes the histamine release? Where is it stored? How does that work? So it's really stored in mast cells and basophils. So this here, if you should see my arrow. These are mast cells, but there's a cycle that goes along with it, or steps. They're produced by neurons, but they're stored in mast cells and basophils. So what happens here is you have an initial contact with an allergen. These little things here are antibodies. Remember, antibodies help protect? Well, what happens here is your body is actually saying, I don't like this allergen, so I'm going to release onto this mast cell here, which have these granules. Now the granules have histamine in it. That's where the histamine's stored. And the allergens then end up binding to these areas, therefore releasing histamine and some other chemicals, which we'll talk about, that go to the site and try to protect it, actually. So it's a good and a bad thing. But that's how our body process is. So when you have an antihistamine, it's actually blocking the receptor sites here, so this allergen won't bother you. It's going to basically not be able to bind to anything, and so the antihistamine is going to work. Okay, and this is just another way to explain it. So phase one, you have your allergen, let's just say some pollen, then your immune system, which forms an antibody. All right, so on the last slide, as you saw, the antibodies. So you have these two responses turn into the antibodies. So then what happens is it binds, the IgE is your antibody, it binds to that mast cell, which is what that next picture was. So this is another picture of a mast cell. And these antibodies, there's IgE receptor sites that are under each antibody because it goes and sticks to these sites. And the IgE is, it says here it's bound to the mast cell, that's what I said. Okay, and I said these are the histamine, and then phase three of it, it releases the histamine. And then gives you all those awful symptoms. All right, so which brings us into antihistamines. So another word is histamine antagonists. We usually don't go around saying, I take a histamine antagonist. Easier way is antihistamines. Now, when we think of antihistamines, what are histamines? We talked about where they're stored, and we talked about how the process works, but what exactly, what are they made of? So there's histamine 1 and histamine 2 receptors. There's actually 4, but we usually will talk about H1 and H2. There's medications for them. And H1 receptors, if you have an issue with environmental allergies, usually that kind of thing, sometimes with skin allergies, you will have an histamine 1 release because that's where those receptors are, is more in, it's actually in all of your tissues, the H1 receptors. H2 receptors, though, are mainly in your stomach, And so that's why if you ever hear of taking Zantac, Pepcid, or Tagamet, those are H2 blockers. If somebody has peptic ulcer disease or any kind of stomach acid issue, you can do the H2 blockers, which helps block those histamine areas, which therefore will decrease stomach acid. And then the H1 would be more of your Benadryl, which we'll talk about the difference between Benadryl and Zyrtec, Claritin, and etc. So what are allergic responses? Allergic responses obviously is a response to something foreign that your body doesn't like. And not everybody has the same allergic responses. I could be allergic to bees and you might not be. But we'll talk about bees in a minute, because that really doesn't deal with histamine too much. Because I said there was other chemicals that go into it. But if you have pollen allergies, ragweed, mold, that kind of thing, you're going to see a lot of histamine release. But there's some other compounds, which I had mentioned in the other slide, and these three are prostaglandins, leukotrienes, and tryptase. What we'll pay attention to today is histamine. Prostaglandins will go over more in the NSAID area because we see a lot of prostaglandins is inhibited by using naproxen and all that. So we'll talk about that later, so don't worry about that. Leukotrienes is another release that can happen, and we see that with anaphylaxis. So there is a medication out there that have leukotriene, more of a leukotriene release. It's called Singulair, that people can take, and that's for people with usually environmental allergies. But if you have an anaphylactic shock, the only thing that will help that, antihistamines won't help. You need epinephrine for that. And then tryptase, there's really nothing out there for that. But mainly with environmental allergies, you're going to have that histamine release and sometimes the leukotriene release. Some people respond really well to the Singulair for the leukotrienes, and some don't. Mild allergic responses are caused mostly by the H1 receptors, which gives you this allergic response from that histamine release. So it just depends on what the culprit is. So if you're breathing in pollen, that's what's giving you that sneezing, nasal congestion, itchy, watery eyes, because that H1 is working, the histamine release, and those mast cells are working in your nasal passages and in that area. But if you have a severe allergic reaction, that would be anaphylaxis, and that would be a serious thing that you need to call 911 for. And this is where leukotrienes are the principal mediators, meaning those are the ones that are pretty much released. So antihistamines really aren't going to work, because antihistamines, hence the word histamine. And epinephrine is the drug of choice. If you want to look at it further, it's in chapter 17. So the two types of antihistamines, just a little bit further, the H1 antihistamine or antagonist, it's a selective blockade of H1 receptors. It's used for mild allergic disorders. And when we say mild, I mean, I'm thinking of the picture of the woman with the runny nose, itchy eyes, and we may not think that's mild. When you have allergies, I mean, you can feel actually miserable, and you're like, this isn't mild, this is severe allergies. But when we think of severe allergies, we're thinking more of anaphylaxis, so just for sake of trying to differentiate between the two. H2 antagonists, or H2 blockers is another name. They produce selective blockade of the H2 receptors, so it's very selective, meaning it's for the H2, right? That's why it's called an H2 blocker. And this is in the stomach, and it treats ulcers. It's not used for treatment of allergies, although off-label it is also treated for like hives and stuff, because there is a small amount of H2 in other tissues in the body. This is off the record. Many of our allergists, if you come in with chronic hives, will give you antihistamines. Meaning they'll give you the H1, which would be maybe like a Claritin or a Zyrtec or even Benadryl. Plus they'd have you get some Zantac over the counter to focus on the H2 receptors in addition to the H1 receptors to get at those hives, because sometimes hives can be very stubborn and difficult to go away. All right, so now we have, let's just break down the H1 now. All right, so we have antihistamines. I always like using the umbrella again. So we have an umbrella, and you have the antihistamine name on the umbrella. And then underneath it, you have H1, and then another fork, H2. Well, let's break down H1 even more. Okay, H1 remembers for the mild allergies and hives, which is they consider mild in this. It's divided into two groups. So first generations came out, first generation H1 antagonists came out a long time ago. That's Benadryl, diphenhydramine. There's some other ones out that are out there too, but mainly we see Benadryl. Second generation histamine 1 antagonists, those are chlorpheniramine, but anyways, H1 antagonists. The main thing is you want to know about the first generation is they cross the blood-brain barrier, so that's your Benadryl. The second generation, now I'm sorry, I'm getting this in my head. The second generation H1 antagonists are your Zyrtec and your Claritin and your fexofenadine, which is your Allegra. Those do not cross the blood-brain barrier. It's just how it's chemically put together. So what do these do? These block the actions at histamine 1. The only difference is if you're taking Benadryl, that's your first generation, and it crosses the blood-brain barrier, which why you can get tired and drowsy, and sometimes people feel out of it because you get that central nervous system effect. Sometimes you can get flushing, reduce itching and pain, because that's what it's supposed to do, is bind to the receptors, therefore stop that histamine release. All right, therapeutic uses, which we did talk about. Okay, why did it, hold on. Okay, therapeutic uses, I'm not sure. Okay, so it looks like these pills are tying up the H1, the histamines, to stop it. All right, so therapeutic uses would be allergies, any type of allergic reaction issues. Now, we've seen Benadryl, some people take it for sleep because it crosses the blood-brain barrier and it can make you tired. It's not necessarily the best thing to take for sleep. It can make you wake up groggy. Some people just get used to taking it. It's just not a good thing to take. But if you have, you know, some severe itching or hives or anything like that, sometimes we'll tell people, take some Benadryl before you go to bed, and maybe that will help you sleep and help the allergic reaction issue. But the other ones that are out there don't cause or cross the blood-brain barrier, but there is one that's Zyrtec, cetirizine, that has a little bit of a central nervous system effect. Not everybody has, it's called the tiredness. Not everybody has that with Zyrtec, but that is the one out of all of them that could cause issues for that. So adverse effects, which I mentioned, sedation, less with second and third generation. And when we say first, second, and third, it just means what came out first, what came out second and third. And they're usually better and better as far as side effects. That's the point of bringing out these second and third, is we're trying to reduce side effects and have it more selective. Non-sedative CNS effects, which I did not mention all of them, but some people would have some dizziness. Coordination problems I haven't seen. I have not seen confusion, but I suppose you could with Benadryl. You can have some nausea, vomiting, loss of appetite, constipation. You should give it with some food. It's more on the rare side they have GI effects with it, but it would be more so with the first generation. It's the second and third generation are tolerated really well. And they have a little bit of anticholinergic effects, which would be more like dry mouth, and because think about it, it's a histamine blocker, so it has a little bit of the anticholinergic effect to it. And adverse effects would be severe respiratory depression, cardiac dysrhythmia, severe local tissue injury. It's very rare that those will happen, but just so you know that that's what can happen with those. So you have to be really careful if you're taking a central nervous system depressant. For example, if someone says, I take Ambien for sleep at night, I would probably not tell them to take Benadryl with it. Or if someone's on a Xanax or something for anxiety or any other sleep medication, you definitely want to be careful and tell them not to take that. You really should not use it in pregnancy and lactation. When with medications, they're categorized A, B, C, D, and X. Yeah, I think they just go from D to X. X is like, we know that it causes birth defects. A is been known, research shows that it's safe in pregnancy. That would be your Tylenol. Pretty much, I think that's the only one that's an A. A few of them are category B, but these H1 antagonists, your Benadryl, your Zyrtec, all those are category C, meaning that we don't have any good data to show that it's good or bad. So you really should not use it at all. There is a really large margin of safety of these medications. Benadryl actually has been tested the most on children years ago. All of these cough medicines that are out for kids have really not been tested on kids just because of the whole research safety issue, but they're out. And when my kids were little, we gave them what was over the counter, Robitussin, DM, and whatever else we give them. Well, there had been some issues and kids having reactions and stuff like that. So really there's the American Academy of Pediatrics some years ago now came out with a statement saying that they're not recommending any of those over-the-counter ones, only Benadryl, because Benadryl we know has been tested on kids, we know it's safe in kids, and there is a wide margin of dosing. So if, put it this way, if a teaspoon is says on the bottle, you could probably give 2 teaspoons and it would be fine. Other than you'll have a lot of central nervous system issues and dry mouth and constipation, but just to let you know, it's safe. It's the safest drug out of many drugs that are out there now. So who are high-risk patients? So antihistamines contraindicated during your 3rd trimester, but don't give it at all during pregnancy. Nursing mothers, newborn infants. Use antihistamines with caution in young children, older adults, patients whose conditions may be aggravated by a muscarinic blockade. Okay, so young children, older adults, again, we're always going to use caution, but again, as I mentioned on the last slide, antihistamines are safe for children. And obviously a newborn, you would not want to give any medications to a newborn, right? All right, so here's your 1st generation. Good. Now we got to the list here because there's so many of them, and I'm just used to Benadryl. And actually, now I'm looking at these. There's other ones too. When you think antagonists, thinking it's like blocking or working against. So these are some histamine 1 blockers used for systemic therapy. These are the ones that cross the 1st generation are the ones that cross the blood-brain barrier. So a lot of your over-the-counter ones you'll see, like the chlorpheniramine, that's your chlortrimeton that's over-the-counter. Your Tavist allergy and Dahist, that's over-the-counter. Your Benadryl, promethazine is a prescription, and some of these are used for other things, like promethazine can be used for nausea. Hydroxyzine we give for itching, but that can make you tired. And cryoheptadine is another one. Now your 2nd generation, they're more non-sedating. The Zyrtec may cause some sedation. So you have your cetirizine, levocetirizine, fexofenadine, loratadine, desloratadine. So what are you seeing? Like an ene, right? Just like all those other drugs that have things to it. So your Zyrtec, and I've never actually heard of Reactin before. Oh, it looks like maybe it's in another country. I don't know. I see a maple leaf. Maybe that's in Canada. Xyzal is your levocetirizine. Xyzal came out later, but Xyzal works really well for hives, by the way. It's just known to. Allegra, your Allergic, Claritin, Tavist, Clarinex, that's desloratadine. Loratadine is just your plain old Claritin. Clarinex is just chemically put together a little bit different. All right, so here's your list. Do you have to memorize the entire list? No, you do not have to memorize the entire list, but I would really try to know your second generation agents. And I would know your diphenhydramine, which is this one, the Benadryl. Okay, as far as dosing for these, they're pretty much standard dosings. Like Zyrtec is in 10 milligrams, 5 and 10 milligrams. These are 10 milligrams daily. These are all 24-hour medications. Whereas these you have to dose every 6 to 8 hours or every 4 to 6 hours because they will just leave your body. They're the first generation ones to come out. Benadryl you can give IV, IM, or orally. And actually Benadryl is part of the migraine protocol in the emergency rooms. For those of you that don't work in ERs. You can give 25 to 50 every 6 to 8 hours. And we already talked about this. So just get familiar with it. I would try to, go to the pharmacy and find these and look for these. When it say levocetirizine, it's spelled wrong. It's Xyzal. It has an L at the end. So that's what I would do. And look at how much they cost. They're very expensive, actually. They work really well, but they're very expensive. Benadryl's cheap. But again, who wants to be tired all day? So here's a question. Sally asks, how do antihistamines work? What are you going to tell them? Tell her. And Sally's like, well, how do these things work anyway? Sometimes we get put on the spot and you're like, oh my gosh, I got to go back to the books, right? So remember everything we talked about in the slides. So A would be they block muscarinic receptors. I don't remember that being one, but, oops, hold on a sec. Okay, do they block muscarinic receptors? Let's go back here. I'm going to go back to the beginning. Not there. Not there. I don't see any muscarinic receptors on there. Okay. So I'm thinking not. Okay. So I'm thinking not. First generation are more selective than second generation histamines. I don't think so. Because when we think selective, selective means that it's targeting a specific part of the body. Okay, so as we know, first generation is not selective because remember, it goes everywhere, even the brain. It crosses that blood-brain barrier. So it's not selective at all. But second generation antihistamines, these are supposed to be antihistamines in the slides there, not histamines. Second generation antihistamines, your Zyrtec, your Claritin, remember, those don't cross the blood-brain barrier. So those are more selective. So I'm not going to pick that answer. Antihistamines block the H1 receptors to prevent actions of histamine at these sites. So yes, I'm going to think that because they do block the H1 receptors. Remember we saw in the past slides, I'm not going back to it. That was dumb of me to do that in the first place. It takes forever. To prevent actions of the histamine because we don't want that histamine release. So it blocks the receptors. So I'm thinking C is the answer. They block release of histamine from mast cells and basophils. No, they don't block the release of histamine from the mast cells. That's where they're stored, but actually it's the receptors. Okay, so antihistamines block H1 receptors to prevent action. So this is where it can get confusing because of the mast cells and basophils where they're stored, but they're actually, antihistamines just work by blocking those receptors. Next question, who should not take antihistamines? Children? Well, it said precautionary, but children can take it. Males over age 60, I did not mention that at all. Your pets, Well, I didn't mention it, but I suppose maybe your pets could take it, right? Pets take adult or people medication and pregnancy, which we did talk about. So which one do you think it would be? Pregnancy, because it's a Class C category. Although it says it's contraindicated in third trimester, it's still a Class C for the entire pregnancy, so do not give it. And that is it of the slideshow.